Welcome to QURE Healthcare. We're often asked, what are clinical performance vignettes, referred to as CPVs? This is a demonstration of the fast, secure, and simple process of completing a CPV. They have been comprehensively validated in peer-reviewed literature and extensively utilized in the US and in 25 countries worldwide. CPVs are designed and shown to replicate an actual patient visit. CPVs are specifically tailored to our individual clients and the question they want to answer. QURE works closely with its clients to identify the target physician population for their study. To log in, the physician goes to cpv.curehealthcare.com, then enters their unique username and password. The first time participants log in, they are asked to complete a brief provider survey where we capture information about their background, their practice, and other determinants of interest, such as payer mix or specialty training. This information is analyzed in conjunction with the CPV scores to provide insights into current practice. After completing the short survey, the doctor begins the CPV, just like a typical patient visit. Each CPV begins with a short presentation of the patient. Today, you will be taking care of a patient with rheumatoid arthritis. Mr. Notwell is a 52-year-old man who has come to the office today for follow-up after an initial visit 4 months ago, at which time you diagnosed rheumatoid arthritis of approximately 6 months duration. There are 5 domains: taking the patient history, physical exam, ordering labs and imaging, diagnosis, and lastly treatment. We'll go through them all today. The first section is taking the patient history. The doctor is prompted to detail the questions they would ask the patient about their presenting problem, medications, past medical history, and behavioral and social history, as they would with any patient. Once the physician has filled out the questions, they can continue to the next domain. They are restricted from going back to previously completed domains. This prevents participants from changing responses based on the feedback they receive. When the physician proceeds to the next step, she receives additional information on the patient based on the type of information gathered in the previous domain. She is then prompted to do a physical examination. The next set of questions ask about what laboratory and imaging studies the physician would order. To further simulate a real-world scenario, the physician only receives real-time laboratory and imaging results if they were ordered. Based on the information provided, she is now asked to provide a diagnosis and to list any secondary diagnoses. The final section asks the physician to detail their treatment plan. Now the doctor has completed 1 vignette. All responses are stored on QURE servers and then sent to our physician scoring team for aggregation and tabulation. Our qualified MDs use proprietary QURE scoring methodology to evaluate every completed vignette. Using the evidence-based medicine scoring methods developed and validated by John Peabody et al., QURE provides an aggregate numerical score for each vignette completed, and vignette data analysis for the entire study sample. The scores are strictly anonymous and can be broken down by multiple metrics, including domain score patterns of test ordering or treatment, by age and region of physician, and type of facility. This data can guide decisions from clinical improvement to marketing strategy to policy making. CPVs allow for repeat measurements to gauge the level of improvement over time and the impact on clinical practice resulting from a specific intervention. CPVs are the most effective measurement of healthcare quality in the industry, providing accurate data on clinical behavior quickly, efficiently, and economically. Contact us today at QUREinfo@curehealthcare.com.